Hi everyone, I'm Tyler. I work alongside Alice Howe here, and we lead up the Anaesthetics and Intensive Care Division for BDI resourcing. Today I've got a long-term friend of mine, Dr Deshmukh, who will be kind enough to give us some time to go through our questions for him that hopefully can help out some of our viewers. So this is Varun.
Hi Tyler. I hope you are doing well. My name is Dr. Deshmukh. For the audience who may not know me, I have trained in anesthesiology in India. I did my post-graduation, and then I did my training in critical care medicine or intensive care medicine. Then I have come here after clearing the EDIC exam, that is the European Diploma in Intensive Care. And now presently I am working as a locum consultant in one of the district general hospitals in the UK.
Fantastic, perfect. Okay, so first of all, I think we'll start with some questions for you, Varun, and they may well help some of the viewers out there and some of the doctors that are looking to go through, get started with GMC or move past GMC and start getting some roles in the NHS. So first of all, I'm aware, like you said, some of the viewers may not be aware that you, through your GMC route, you completed the qualification of EDIC, the European Diploma of Intensive Care. Can you maybe shed a bit of light on maybe why you chose that qualification in particular and how you think it helped you?
Yeah, sure. So from my point of view, when I was training in the intensive care medicine in India, I was actually learning new things and I had to appear for the exam. And when I looked at the EDIC, the curriculum, it was quite a bit of the curriculum was overlapping with my own curriculum in India. So I thought, why not give it a try? Since it is an international qualification, it will add to my portfolio and it will improve my chances of securing a better job. So that was the reason why I chose EDIC, because it was easier for me to prepare as it was overlapping with my preparation. At the same time, I would also like to tell you that when I cleared the EDIC, it was not acceptable for the GMC registration. But after 2 years, I think in 2018, they accepted it as a requirement, and that's how I thought maybe I can give it a chance and try my uh, get some experience in the UK and see how it goes. So it worked in my favor that I had already cleared the EDIC, and that's how I could get the GMC registration.
Yeah, fantastic. Yeah, so for some of the viewers out there that may not know, EDIC wasn't always accepted by the GMC or recognised as a postgraduate qualification for your GMC registration. For some of the other doctors out there viewing, you would have to have had sit EDIC after 2015, after August. EDIC wasn't recognised until, I think, like Varun said, around 2018. However, you would have had to have sit EDIC after 2015 in August, because I believe the curriculum did change around that time. So for anyone looking to pursue GMC registration, anyone looking to sit EDIC now or anytime in the future, it will be and has been accepted by the GMC. So we can move on to the next one. What sort of, well, I think for you personally, what sort of advice would you give to doctors out there that maybe have plans to sit EDIC in the near future, or are planning to sit it at some point? What advice would you give to them?
So probably, I think one should have a very clear plan what they want to do, and if they want to clear EDIC, probably when they are training in intensive care, that would be ideal time, because I believe everywhere the learning would be same and most of the curriculum would be the same. EDIC consists of two parts. First part is MCQ, and second part is OSCE and clinical questions. So when you are appearing for your critical care training exam, probably you can time the EDIC exams in the same way, and you can save the effort of preparing for two times for two different exams. Now for the MCQ part, you need to really revise the MCQs. There are various books. There is a book by Steve Bennington. There is a multi-professional MCQ book by the Society of Critical Care Medicine, USA. And in India also there were various MCQ books which I used. And just reading them once is not sufficient, so you have to revise them more than once. You have to discuss with your colleagues who are also interested in. So maybe group reading is a good idea. And generally the questions are not just lifted and asked like that, but if you know the topic, the topics are repeated very often. So you have to keep that in mind and not just focus on the single question, rather focus on the particular topic which is repeatedly asked. Another thing, when I appeared for the first part MCQ exam, as soon as I finished the exam and came out, I realized that it was not based on the recall method. So they would not ask you the specific facts which you can just remember and reproduce in the exam. They would ask you something where you have to apply your brain. And when I came out from the exam, I realized that if I don't pass this exam, probably I need to work harder, because whatever questions they had asked, they were all relevant questions. And I believed if you pass the exam, if you want to pass the exam, you must have certain standards, which was, I think it was a very well conducted exam in that way. So probably along with focusing for the MCQ, you need to improve yourself as a doctor and improve your knowledge, which is the ultimate goal of all these exams. So that is about part one. Now, part two is a kind of a practical exam where they have computerized scenarios, where they give you case-based scenarios. The case starts with some history, some vignette, and based on your answer, it goes on forward. So you need to discuss the case, discuss the differential diagnosis investigations, what happens further regarding the complications of that case. So that is one part. The other part is seeing the image and commenting on that. So any CTs, MRIs, or chest X-rays, ultrasound images. There is also a part where you discuss the biochemistry, you discuss the various graphics, ABGs, ECGs. So that's all part of the second part of the EDIC exam. And I think for this part, one thing is that is PACT module, PACT. PACT module is a module prepared by the European Society of Intensive Care Medicine. If you become the member of the society, you get access to the PACT module. And there are numerous modules, I think more than 50 modules on various subjects. And each module, you will take around 7-8 hours to finish that. And that will really increase your knowledge and your confidence. And I felt that the questions were based on the learning given in the PACT modules. So you have to do the PACT modules. That is one thing. Second thing is, when you see the patients in your unit, wherever you are working, just keep in your mind uh, whether this patient, consider all the differential diagnosis, consider what are the investigation you would like to send, what is the plan of treatment that you would like to make. And then when your senior or your consultant comes and gives some orders, check whether your and the consultant's plan match and what things you missed. And that's how probably over the period of 6 to 8 months, you will gradually improve upon yourself and learn new things. Also, when you get some interesting case, read the theory aspect of it, and then you can probably correlate the theory that you learned with the actual case. So that is also a good thing. Another thing is, since it is a oral exam where you have to speak the answers, it is always good to speak to your colleagues, to speak to the family, to speak to other specialties regarding that particular case, discuss various aspects, see what questions they are asking. That will that will improve your vocabulary, that will make you more fluent. And at the same time, it will reduce your hesitancy to speak up. So when you are in the exam, you speak more confidently, more fluently, and you speak to the point. You don't fumble around and give answers in circles. And so in this exam, there are keywords, and it's a very well conducted exam. So there are specific keywords for each answer. And if you speak those keywords or buzzwords, you are given the marks. So even if the examiners may be from various parts of Europe, their English may not be very strong, but if they see the keyword that is there in their answer, and if you are telling them the keyword, you will get the marks for that question. So focus on certain keywords rather than beating around the bush and giving lengthy answers. And if you are giving them the keywords, they will move to the next question, and that's how you know that probably you have given the right answer. Regarding the images, ECGs, ABGs, and various things, probably you have to see them every day in your unit. You have to read the reports, correlate the images with those reports, and that's how you will come to know whether you are learning it the right way, because it is very difficult to learn these things within a short period. So make it part of your practice, and over the time you will realize that you have gained significant amount of knowledge, and for the exam it will not be very difficult for you to attempt these questions. So that is the other thing. So probably I think for the viewers, I have a YouTube channel and I have made a video regarding how to prepare during your training in intensive care, and maybe you can get that to see that video, and I have put more information there, and maybe that may be helpful to you.
Thank you. That's fantastic and thank you for such an in-depth answer on that. I'm sure that will massively help out a lot of the doctors, and hopefully ease their concerns a little bit with the examinations coming up. Yeah, like Varun said, definitely check out his YouTube channel as well. He's, I've been following his videos as well, and I imagine they are extremely helpful for any of the ICU doctors out there that are looking to join the NHS in the near future. For the next question, I think we'll get into a little bit about your role in the NHS. And hopefully you can give them a bit of insight into what it's like. So we know there's a few differences across the healthcare systems and centres in the world. So could you just outline for us your sort of roles and responsibilities as a consultant in the NHS?
Yeah. So as a consultant, my role is there are various aspects of my role. The main role is clinical role, where I have to clinically see the patients and manage them. Part of the job is in the ICU. Part of the job is in the outreach. Outreach means I have to go to the A&E wards or emergency procedures, like say in cath lab, or for the transport of critical patient. And whenever the patient is critically ill and not in the ICU, the outreach service will cover those patients. And if they need ICU care, we will bring them to the ICU. If they can be managed at that same place, we will advise them on that, and we will follow them up. So that is the outreach. So if you are doing, say, anesthesia and intensive care, probably you can get some time in anesthesia also along with the intensive. If you are doing respiratory medicine or say emergency medicine, then you get to spend some time in your specialty. In my case, I am doing ICU for the full time. So I am doing ICU and outreach services mainly, but that's the clinical part of the role. The other part is training the students. They may be undergraduate or postgraduate students. So I train them at regular interval. There is a proper rotation of seniors who will guide the students, mentor the students, and the training is theoretical lectures and bedside teaching, and also includes skill-based clinical skill teaching. So I take part in all of that. We have research activities going on, so I participate in those trials. I help them recruit the cases and follow up of those cases. So that is the research aspect of it. And the other part is administrative part, where we do mortality and morbidity meetings every month. We discuss the cases that did not go well and what could have been done better, and we improve ourselves on that. We have quality initiative projects, so we monitor certain aspects and improve the quality of care over the time. And there is also clinical governance, where the hospital administration, starting from the CEO, may be involved, and you take decisions on the larger things. I think that's probably all about the role a consultant has to play in the NHS.
Fantastic. And then I guess leading on from that, then, what would you identify as being the sort of the main differences between working as a consultant overseas, where you were previously, and working as a consultant in the NHS?
Yeah, so I think from where I come from, I found this system very organized. There is everything in place, and everything is protocolized. So you don't have to worry about fine-tuning small things. The nurses are well trained compared to where I come from, because they have certain qualifications or standards to clear before they can get the job. Even the doctors have certain standards, because in my country we would take various doctors in various level of their training. and there would be no standard of the knowledge or skills that would not be there. Here they have various kind of doctors, but at least there is certain, the course is their course is fixed. Their training is comparatively better, in my opinion. So there is some good standard in nurses and doctors. The doctor to patient ratio or nurse to patient ratio is also better. So patient gets to be seen in more details. The doctors get some time to personally study and uh, add some more input into the patient care. So that is beneficial for the patients as well. Also, there is more quality control, and so that is a good thing. And they analyze things at a regular interval and see what more we can do, how we can improve the efficiency of the system. So I think that is a good thing, because they introspect and improve the part. The administrative part is something which is given more stress here compared to India. India, the clinical part was predominant part that we would play. Here, there is administrative role as well, which is something different. And uh, personally, if you say you get better opportunity to learn, you get more time to spend with your family, you get more growth potential to improve your career. So probably that is on the personal aspect. And overall, if you say, I would say there is there is more rather peace of mind, because when you are not working, you will not be bothered by them, because there is someone else taking care of the patients, and you can do whatever activity you want to do. So there is more peace of mind once you leave the hospital. You just switch off your clinical brain, and you live your normal life. So that is
Yeah.
something which is I found it is better compared to my previous experience.
Yeah. Okay. So I think again, still on the topic of the transfer from a different healthcare system, what would you say surprised you the most about moving from India into the NHS?
Okay, so as I told, probably I might repeat on some of the points, but there is
Mhm.
a, I have enumerated the points. So there is a better work-life balance, as I discussed. There is good doctor to patient ratio, nurses to patient ratio, which helps patients for better care, and helps the nurses and doctors also to be less stressed, and can prepare better. There are better trained nurses. There is a concept called SPA. That is, I think, structured program activity, which I was not aware of before I came here. That
Mhm.
surprised me, because they allot you some time, 4 to 6 hours a week, where you have to work on improving upon yourself, learning new things, or maybe teaching. So that's whatever you do, that's also counted in your working hours. So that is something which surprised me pleasantly, and that is a good thing. So while being on job, while being paid, you can learn and you can improve yourself. So that is something which I like. There is a structured system, so you can get leave for the conference, you can get study leaves, which is a good thing in my opinion. Coming to the patient care, they often do MDT, multi disciplinary discussions, where specialists from different specialty meet together, discuss about a particular case, and with the patient's family also, they all discuss in a group. And I think that helps streamline the care of the patient, and that helps communicate well with the patient's families as well. So that is also a good thing. And as I said, it's a protocolized system, so you don't need to worry about small things. And it is a comprehensive patient care experience. So you have people working from starting from the smallest things to the larger picture. So you have got people for everything, and that really helps in patient care. And everybody is doing their job. So if all the small parts are moving well, the whole machine moves well. So in that way, I think it's a good thing.
Mm. Yeah, well, it's lovely to hear that all of the surprises were positive ones. That's always
Yeah.
a good thing. That's great. So, last but not least, what would you say for you is the best thing about working in ICU within the NHS?
I would say the best thing probably would be the work-life balance. I just had a child and I could spend a lot of time with my son. I can follow my passion of teaching. I can prepare YouTube videos. I can follow my passion of music. I like photography, so I travel. I take photos. So those all things could be possible because I could get some time to spare, and at the same time I could continuously work on my improving my knowledge and skills. So I could strike a good balance within last few months since I have been here. So probably that is the best thing in my opinion.
Yeah, fantastic. Yeah, I do see your photos on Facebook. It's very nice to see. How would you feel like that compares, like the work-life balance that you have now working in the NHS? What does that compare like? Just I guess just so the viewers can understand the difference that it offers. What was the work-life balance like previously for you, compared to how it is now?
So see, previously I say since I was kind of heading the Department of Critical Care, I was like a lead in intensive care in my previous job. I would get phone calls at all the times. I was responsible for making rota of the doctors, junior doctors. So every day there would be some problem. Somebody would fall sick, or somebody would want an exchange of duties, and so every day some time would have been would I would have to spend in that. I would get phone call at any time, including midnights or even later than that. And I was involved in direct patient care, and I got patients directly under my name. So patients would get admitted under my care. So then, since it was a private setup, if anything goes up or down, they will always inform me. So in a way, it is a good thing, but I would not have any personal life at all. And even at odd hours, something I would end up in the hospital and trying to sort out the problem. So probably that is something which is better here. Also, there would be difficulty in getting leave for conferences, or I could not even think of preparing for any course or anything to upgrade myself, because there would be no time to do anything like that. And
Right.
to large extent, even the social life would get affected. In the NHS, probably not just NHS, everywhere in the UK, Saturday, Sunday is a holiday. So that was not the case in my previous job. So that is a so I do one weekend in 8. So out of the 8 weekends, 7 weekends I am free to do whatever I want to do. So that is also really a pleasant surprise, and I think that's a good thing.
Yeah, fantastic. And I'm guessing with the new addition into the family as well, I'm sure your family appreciate the free time that they get with you now compared to
Of course,
previously. So
of
that's,
course. I
yeah,
think
that's very nice. It's always to
that's a
hear.
really big thing.
Yeah. Okay, fantastic. Thank you everyone for watching. I very much hope that this sort of Q&A with Varun has been helpful to you in some way, maybe giving you some insight into the upcoming exams, or just give you some knowledge on what the transition might be like coming from overseas into the NHS. And also thank you, Varun, for your time today as well. If you want to sort of inform the viewers about your YouTube channel, hopefully they can head over there and check out some more interesting videos as well.
Yeah, thank you, Tyler, for this session, and I hope it is helpful for the people who are overseas and looking for a change and want to join NHS. I hope it helps them. My YouTube channel is called Dr. Deshmukh. I put videos explaining basic things which are useful in day-to-day practice. I also try and break down complicated things and make them simple to understand. So please check out my channel and follow me on YouTube. And I hope this session was helpful. I would also like to thank the BDI resourcing team for their support during my transition from India to the UK. They have been helpful in getting me various offers, giving me information before interviews, helping me out, even during the visa and transport process, and also getting me the accommodation. So they have been very cooperative and helpful, and I am very thankful to them.
No problem at all. It's been my pleasure. If there's any other viewers out there that would like our support, either whether they're in the NHS already or whether they're overseas looking to get into the NHS, please feel free to contact us. You can get us on the website, which is bdiresourcing.com, or you can contact me directly on my email, which is Tyler, Tyler, at bdiresourcing.com. I'd be happy to help any of the viewers out there.